Hello, everyone, and welcome. My name is Dr. Abhinav Humar. I'm the clinical director of the Starzl Transplant Institute at the University of Pittsburgh. And I'd like to speak today about live donor liver transplant in the United States, current state, and the future of it. First, a warm welcome to everyone from the University of Pittsburgh, and I'd like to just start by paying tribute to the man who you see in the background there. That's Dr. Thomas E. Starzl, regarded by many as the father of modern-day transplantation. It's really through his efforts that liver transplantation became a reality. And if you're interested in a good read, I would recommend that you read his memoirs. It's called The Puzzle People. Or if you don't have time for a read, then I recommend that you watch a good documentary. It's called The Burden of Genius, and it details the life of Dr. Thomas Starzl. So before we start about talking about live donor liver transplant, let's talk about the current status of liver transplant in the United States. And the current status is that we have roughly about 14,000 people that are waiting for a liver transplant, and we do only about 8,000 to 9,000 transplants a year. And that creates what's called the gap between the number of people who are waiting for a transplant and who actually get a transplant. And that creates a waiting list and a waiting time. And there's several important consequences for individual patients of this waiting list and this limited resource. In the United States, what this means is that there's roughly about a 15 to 25% chance that a patient will never get a transplant because they will die from their liver disease before they get to the top of the list. It also means a longer waiting time before they actually get to the top of that list, and hence a more debilitated state before they actually receive a transplant. And finally, it means that not all patients that could benefit from a transplant are actually offered a transplant. And that's an important thing to stress, because if you look at current data, there's roughly about 300,000 people that are admitted to hospital every year with a diagnosis of cirrhosis. And even if only a fraction of those would qualify for a transplant, let's say 10% or so, that's still quite a lot of people, and yet we're only doing about 9,000 transplants. So it's really just the tip of the iceberg. So we need solutions to the problem of limited organ supply, and one possible solution is a live donor liver transplant. Not the only solution, but a possible solution. What exactly is a live donor liver transplant? It represents the removal of part of a liver of an otherwise healthy individual and donation of that into the person who needs a transplant. Now, we're very familiar with live donor transplant with a kidney, and that's much more natural because we have two kidneys. It's more difficult when there's only one organ, such as the liver. But we can do this because the liver has two unique properties. One, it has a lot of extra capacity built into it. We don't need all of the liver that we have. And two, the liver has tremendous regenerative capability. So both in the person who donates the liver as well as the person who receives the liver, that liver will regenerate to full size within a matter of a few weeks. And there are many advantages to a living donor transplant. It obviously decreases waitlist mortality if you don't have to be on a waiting list. It decreases the waiting time. We can transplant individuals before they become critically ill, as opposed to when they get to a top of a list. And it converts an emergent operation, such as a liver transplant, into an elective operation that can be done when the potential recipient is optimized. There are other advantages, including the fact that it adds to the potential of number of organs that we have available, and some financial benefit also, as I'll talk to later. Obviously, everything we do has to be balanced by the disadvantages of a medical procedure, and the main disadvantages of this procedure obviously are the risk to the donor. This is an individual that doesn't need an operation and yet is volunteering to have an operation, and therefore we have to be sure that we know what the true risks are in that individual donor. And yet, despite that, the number of live donor liver transplant in this country remains relatively low. It makes up roughly 5 to 6% of the total number of liver transplants that are done on a yearly basis. Contrast that to many other places around the world, such as the Middle East, India, or the Far East, where live donor liver transplant makes up 95% of the total number of transplants, and deceased donor transplant makes up a very small portion. And there are very few programs in the United States that have really embraced live donor transplants. So if you look at the number of programs that are doing above, let's say, 10 or 15 transplants, live donor transplants a year, there are very few programs that are doing that. Transplant field is very heavily scrutinized in the United States, and results are carefully monitored. But the main reason really has been complications, especially in donors when they've occurred, have been heavily publicized and have led to risks to programs and individual surgeons. And that has led many in the transplant community to believe that a living donor transplant is a risky procedure that should only be reserved for the lowest risk patients. And that's really the opposite of the way we should be thinking of it. And so as a result of this, most patients actually are not informed about the possibility of a live donor transplant. And we hear this all the time in patients that are referred to us who tell us that they were never told of this option, or who found out about it very late, or who were told that this could only be done for pediatric patients, or that only family members could be donors, or this was only possible for kidney transplant, all of which are not true. But for many, and finally, American society is very accepting of living donation. When we had done a random survey a few years ago, asking just patients, not patients, but asking a random population who had been told about live donor transplant and what the risks were and what the recovery time was, if they would be willing to be a donor for someone that they knew, 70% actually said that they would be willing. And in fact, surprisingly, 40% said that they would be willing to be donors for someone that they didn't even know. So very surprising results that demonstrate that the American population is very willing to consider living donor transplant. So we've at our center strongly believed in live donor liver transplant and have made a concerted effort to really grow our program. Over the last several years, we're doing roughly about 70 to 80, almost close to 100 transplants per year. That represents roughly about 65% of the total number of liver transplants that we do at our center. So naturally, if you're going to push on live donor transplants, you have to know about the outcomes, and we track our outcomes very carefully, both in the donors as well as the recipients. So in our donors to date, knock on wood, we've not had any donor fatalities, no incidents of liver failure. Our overall complication rate in donors is roughly about 15%. And of those, major complications, meaning anything requiring a reoperation, is roughly about 6%. Our results in our recipients have been similarly very good. So two specific things that we've noticed in our program is that the transplant rate has significantly increased and the waitlist mortality has significantly decreased. And these are important for patients because the transplant rate tells the patient what's the likelihood that they're going to get a transplant at an individual program, and our transplant rate has tripled over the last 6 years. And the waitlist mortality, which tells the patient what's the likelihood that I'm going to die while waiting for a transplant at that program, and our waitlist mortality has dropped by half over the last 6 years. So at our center, a living donor transplant represents the first option for all of our patients. Doesn't matter whether they have acute or chronic liver failure, whether they have a low MELD score or a high MELD score, whether they're young or they're old, they're primary or they're redo transplants, they have a tumor or a non-tumor. If they have a suitable living donor, we always feel that that's the first and best option for those patients. In fact, I'm often asked, are there any recipients that we feel that should not get a living donor transplants? And my simple answer is that if they need a liver transplant, then no, a living donor transplant should always be the first option for these patients. And my belief in that statement is based on my belief that that a living donor graft is the best graft. It comes from a young donor. It's non-fatty by virtue of selection. The donor has normal liver function tests, and there's minimal ischemia. That is an ideal graft, and therefore the living donor graft is always the first choice. Additionally, the living donor transplant is an elective transplant. It allows one to optimize the recipient as well as all surgical teams to make sure that the best team is available to do the patient who's in the best possible condition that they can be in. And so we've done several things to try to push living donor transplants at our center. including the fact that we will do patients once they reach a certain minimal threshold of MELD score and have evidence of decompensated cirrhosis. We don't differentiate for high MELD scores. We've done several patients who have MELD score of 40 and plus with living donors. We try to provide maximal resources for individual patients to help them find suitable living donors, teach them how to use social media to essentially enlarge their family circle of patient selection. Well, live donor liver transplant started first just for pediatric patients where just the left lateral segment was removed, a small portion of the liver, roughly about 25%. But we've then subsequently expanded the indication to larger children, and now to adults, where we utilize generally the right lobe of the liver, and that allows us to offer a living donor transplant to virtually anyone who's in need of a liver transplant. And as a result of this, our patient selection has expanded, so many patients who were not eligible in the early days are now eligible. And as I had mentioned previously, it really for us represents the best choice, and we offer this for all of our patients. Our surgical techniques have allowed us to decrease complication rates. The utilization of modulation techniques, the microscopic anastomosis techniques have all improved the results. Next question, what are the recent advancements and innovations in living donor liver transplants that have improved outcomes for patients? So there have been several things that we have changed at our center. In the donors, we've adopted what's called an ERAS pathway, which stands for early recovery after surgery, and trying to utilize or minimize the utilization of narcotics after transplant in these patients. Many centers have started to look at adopting laparoscopic and robotic approaches to liver donation as a ways to improve and speed up the recovery time of patients. On the recipient side, we've utilized and incorporated flow modulation techniques in the operating room to optimize flow to the liver graft to ensure that there's adequate flow, not too much and not too little. And this has allowed us to utilize smaller grafts and make this applicable to more patients. Next question, what are the key factors that contribute to successful surgery and post-transplant recovery? So there are many factors that are important in ensuring a successful surgery, but the keys are to be really well prepared before the surgery, know all of the details with regards to anatomy of the donor, and that requires really extensive imaging on the donor, know what the volumes of the liver are, so that you've actually planned the surgery well ahead of time before you're actually in the operating room. And in the operating room, careful attention to detail, both in the donor and the recipient, helps to minimize blood loss and ensure a smooth course. We have a protocol-driven approach to these operations so that we do them in a very systematic fashion, and there's no deviation from that protocol unless absolutely needed. Some of the important things that in the recipients that we felt have been important, especially in the post-transplant management, includes a team approach, management of fluids, careful management of flow, and careful monitoring for complication in recipients. At our center, we have a couple of initiatives that we've undertaken to try to improve this field. One area that I wanted to highlight are trying to devise methods of tolerance. We're looking at innovative ways to measure and monitor for rejection in these patients so that we can pick this up well ahead of time and know which patients are going to succeed in staying off of immunosuppression and which patients may need to go back. So with that, I'll end this presentation, and thank you very much for your attention.